condition is often poorly understood but can lead to painful episodes in many women. So today, let us look at 12 facts about Bartholin's abscesses. Make sure you stick around to the end because the last fact will be answering the question, why do doctors refuse to remove a Bartholin cyst if you keep getting repeat infections? 1. You can't get a Bartholin's abscess without a Bartholin's cyst. And you can only get a Bartholin cyst if you have a Bartholin's gland. So what is that? Yes, everyone has a pair of Bartholin's glands. Although in men, they are known as bulbourethral glands and are located at the base of the penis where you can't really see them. The Bartholin's glands are found to the left and right sides between the vulva and the opening or entrance of the vagina. But what are glands? Well, let me remind you of some biology. Remember, you have glands all over your body. Generally, a gland's job is to produce or secrete some fluid or chemical like hormones. Examples, of course, are the thyroid gland or your adrenal glands and so on. But back to your Bartholin's glands, these produce mucus, a slightly alkaline fluid whose essential job is lubricating the vagina. And this is similar to what the corresponding glands do in men, where they serve as a lubricant during sex. Now, the following fact is a bit of trivia. But did you know that your Bartholin's glands are named after a Danish professor of medicine called Caspar Bartholin the Younger? He first described the Bartholin's glands over 300 years ago. So now we know a little bit about the gland. How do we get from gland to cyst? Well, inside the gland are several cells which work to produce the fluid I talked about earlier. Eventually, this fluid is emptied through a tube or channel called a duct. If the duct becomes blocked, the gland then becomes swollen with that fluid, and that is how you have a Bartholin cyst developing. The duct blockage, which leads to a cyst developing, can happen most commonly due to an infection, but can also be caused by injury to the vulva area. Now, before we go on, let's discuss who is at risk or more likely to develop a Bartholin's cyst. And the answer to that is any woman can develop Bartholin's cyst. However, it does tend to happen more frequently to women within the childbearing age, and especially between the ages of 20 and 29. It seems you are also less likely to have a Bartholin cyst if you have been pregnant more than once at least, for reasons we don't fully understand yet. This next fact looks at symptoms of Bartholin's cyst. The cyst can be very small and cause no symptoms, or it may be a small lump that disappears by itself after a couple of days. You might feel the small lump if you examine your vulva as you wash. It might not be too uncomfortable, and like I said, it goes away by itself. Often, this type is not caused by an infection. Perhaps it may develop due to some friction from your clothes or during exercise when tissues rub against each other. So the cyst has developed because the duct is blocked. But what if it's not a matter of friction or pressure during exercise? If the cyst is infected, it begins to get bigger. In that case, you might experience a very painful or tender lump in the vaginal opening, often to one side because both glands don't tend to get blocked or infected at the same time. You might also experience pain when walking or sitting down, pain during sex, or even develop a fever. And this is where we enter the realm of Bartholin's abscess. One of the germs most likely to cause an infection in the Bartholin's gland is E. coli, which usually lives in our bodies around the anus and makes up in small quantities some of the natural germs that are in our body. E. coli might easily transfer from the back to the front during day-to-day activities, perhaps washing or dressing or after sex. And that way, the germ can infiltrate the Bartholin's gland. But other germs that cause sexually transmitted infections can also affect Bartholin's gland, including chlamydia or gonorrhea. Many times, an infection with the cyst will grow very quickly. An abscess is an infection in relatively advanced stages. Early on, the infection may be controlled using antibiotics. Still, if treatment is not provided quickly, the cyst can become a closed-off sac containing pus, which is an abscess. In this case, the treatment is known as incision and drainage, which is pretty much what it sounds like. A cut is made into the tissue around the abscess to drain the pus, clean out the cyst and relieve the blockage. It is performed under a local anesthetic, and you may be given a course of antibiotics to prevent further multiplication of germs. But let's back up a little bit. Suppose this swelling is a cyst. It's not infected, it's a small lump, maybe a bit painful or uncomfortable, and you know something isn't exactly right. What are the treatment options? These types may go away on their own. However, your body's immune system, which is trying to stamp out the inflammation, could do with some support. And here you could use a warm compress or soak in a Cysts bath. Cysts baths are amazing little devices used to treat conditions like piles, Bartholin cysts, or episiotomies, those cuts that women get when they're about having their baby vaginally. With a Cysts bath, you can soak the affected area with warm salt water several times during the day. This treatment can be quite effective. It can take 2 to 3 days, after which the cyst will burst and drain on its own. So these are some facts about Bartholin's abscess and how it develops, starting from the gland. And the last fact, like I promised, is the trouble that this condition can cause when it happens repeatedly. If you've experienced this, you know just how quickly things can go from 0 to 100 with respect to pain and swelling. Many times there's only very little warning, and just like that, you find that you need to be admitted to hospital to have the abscess incised and drained. And so one of the questions I often get is, well, why can't we just stop this from happening over and over again? Why don't we just take out the glands or deal with the cyst instead of waiting for an abscess to develop before we do anything? Well, to answer that question, there are surgery options for abscesses that keep happening or cysts that just keep coming over and over again. One of them is called marsupialization. In this case, the surgeon creates a permanent opening within the cyst after cutting into it to drain, and so there's no chance of it collecting fluid again. Secondly, surgery can be performed to remove the glands for very persistent cysts. But this can be risky surgery. It needs to be performed under general anesthesia. It also needs to be performed by a competent surgeon because there is a huge risk of bleeding during or after the surgery, given that the tissues around the glands are full of an extensive and rich network of blood vessels, which is why it is usually performed with very great care. Given these potential complications, some specialists may be reluctant to go into removing the gland unless there is really no other option or it is extremely troublesome. However, I do urge you to discuss your specific condition with your gynecologist to see what they think and what option best suits you. So I hope you found this exploration into Bartholin's gland, cyst and abscess useful. Don't forget to always keep track of any vaginal lumps and see your doctor if they're growing or getting painful or you have any other concerns about them. Thank you for watching. Please give this video a like and of course consider sharing with a friend. Let me know if you have any questions using our email information served. I will place the link to this in the description box below. Don't forget you can check out more health information videos. Here's the playlist here, and I'll see you again soon. This next fact looks at the symptoms of Bartholin's cyst.